With the recent debate about abortion, more attention now on contraception and access to it.
Earlier this week, a French company applied for an FDA approval for an over-the-counter pill. 9 Health medical expert Dr. Payal Kohli joining us now. So this is new, and we'll talk about it. But first, give us an idea of the landscape around contraception at this point.
So many different options when it comes to contraception for women, which is great. The traditional option has really been the birth control pill, and that's usually a combination of estrogen and progesterone. They do have a progesterone-only pill, but we do need prescriptions for those. You can also obviously get an IUD, which is an intrauterine device. You also need a doctor to put that in. There's a depot shot, which is an implantable birth control that you can get. Again, you need a doctor to put that in. There's a Nuva ring, which is a vaginal ring. Need a doctor for that. So the only thing we really have that doesn't require a prescription at this point is barrier contraception, such as condoms or cervical caps.
And you feel like it's accessible, and maybe that's, ignorant to think. Can you quantify that? Like how many women lack access to contraception?
Up to 30%, according to a survey in 2016. Wow. So 3 out of every 10 women don't have ready access. Yes. And the fact that it's prescription only is part of that barrier to care. And that's what I think something like this is really trying to break down, which is let's try to get more access to more women. But a big piece of that, of course, as you can imagine, is education. Because if you're making this accessible over the counter, you need to be doubly, triply sure that people are educated about the proper use.
So let's talk about this over-the-counter option, which would be new. What are experts in the field? What are doctors saying about this?
Very excited. So the American College of Obstetrics and Gynecology has full support of this, as does the American Medical Association. But again, I'll add that warning that especially when we're making it accessible to individuals such as teenagers or adolescents or really anyone who can walk into a pharmacy and now buy this, you want to be sure that you advise them of the risks. Now, this over-the-counter option is safer than the combination estrogen-progesterone because it doesn't have the estrogen component, which is the part that increases your risk of cardiovascular disease, raises your blood pressure, can increase risk of blood clots. So that's really what you need sort of doctors to screen for. But this option has been used in Europe for many, many years very, very successfully.
I think this is great, but I'm also a little skeptical, right? Because birth control has been around since the 60s and we've never had an over-the-counter option. So how effective are these going to be? Like, how do they work, I guess, is the question.
So progesterone only is not as effective as the combination pill, and it's much more prone to user error. In other words, if you miss a dose, your risk of pregnancy goes up much more with the progesterone only than it does with the combination pill, because that combination pill works in the brain to shut off ovulation. So it actually turns off the ovaries releasing the egg. Whereas this works at other parts. It works on the cervical mucus, it thickens that, works on the lining of the uterus. Some women stop ovulating on it, but it's more prone to error. So if you have 100 women who are taking this perfectly, in other words, they never miss a dose, only 1 out of 100 will get pregnant on it. But a typical use, meaning the way most average people use it, about 9 out of 100 will get pregnant on this. And keep in mind, of course, this doesn't protect against sexually transmitted infections.
In a way, there's some similarities to what we've seen in the past with birth control pills, because to your point, a lot of people don't use them exactly as prescribed. There was room for error. When we think about side effects of the traditional birth control pill versus this over-the-counter option, similar, different?
A little better, actually, because it's not 2 drugs, it's only 1 drug. It's progesterone only, so you don't get a lot of the headaches, the bloating, the weight gain, some of the things you can get with the estrogen component. You may not see as high blood pressure. You can see some spotting, bleeding, menstrual irregularities because it's changing that lining of the uterus. And so some people are very, of course, bothered by that as well.
Okay, but overall it feels like a move in the right direction.
Very much so. I mean, this is really what we need here, and we need to step up the efforts to educate so that we can make this a safe option. But really, it's been shown overseas to work very effectively, to be safe, and to be something that we really ought to start moving so that people can access it without that prescription.
Super interesting. Yeah. All right, Dr. Kohli, thanks so much for joining us today.